In an emergency department, the emergency physician leads a care team of physician's assistants, emergency nurses, and other essential professionals. Each healthcare professional plays a critical role, but what actually sets an emergency physician apart? A physician is required to complete 11 or more years of formal education and is the only member of a care team that completes a medical residency. During this program, they treat actual patients, working hands-on with real people, not just simulated experiences. Residents train under the supervision of a physician to diagnose, manage, and treat any illness, any injury, any unexpected complication. Before residents can practice medicine, they must pass a series of tests, earning a medical license with the option to become board certified, the gold standard in their specialty. Compared to others on their team, physicians also have the most hands-on training with real patients. A nurse practitioner is required to clock at least 500 clinical hours. For a physician, that requirement is at least 12,000 hours. It takes thousands of hours and years of experience to be able to identify the subtle symptoms that could mean the difference between life and death. From simple to complex, they are prepared for anything.